Hi, Dr. Barn. I love me some histology. We're going to talk about types of collagen. By the end of the session, I want you to be able to compare the structure, histologic staining patterns, location, and functions of collagens type 1, 2, 3, and 4. Now, connective tissue is comprised of three main fibers. You have your collagen, elastic fibers, and reticular fibers. Collagen is the most abundant protein in the body, and there's typically 28 collagen types, but we're really going to focus on four main types in this lecture. There's different categories according to the structure of the collagens. So the fibrillar collagens are the type 1, 2, and 3 forms of collagen, forming these large fibril units. There's also sheet-forming collagen, which is typically seen in collagen type 4 of the basement membrane, right? It's the basement membrane is like a sheet of collagen. There's also the linking or anchoring types of collagen, and we typically see this with type 2 forms of collagen. And this is where, again, you can connect or anchor the basal lamina to the reticular lamina. Remember, we talked about basal lamina and reticular lamina in the basement membrane lectures. With collagen production, the fibroblasts produce your collagen. Recall again, fibroblasts are these small little elongated cells with an elliptical nucleus. You can see extracellular collagen bundles. Ultrastructurally, you can see intracellular collagen bundles with abundant RER and the Golgi apparatus. I want you to be able to recall again Dr. Romana's lecture in FOM of collagen production. This is very important to know, always high yield on exams and boards. The the pre-pro collagen is produced intracellularly in the RER. You have your alpha chain backbone here, which then eventually undergoes your hydroxylation. Recall again that vitamin C is required here for hydroxylation. Then it undergoes glycosylation, production of the procollagen, which is a triple helix form. After, again, it's packaged in the Golgi apparatus, it is shipped out, exocytosis, out of the cell into the extracellular space where you have cleavage of your procollagen, which becomes your tropocollagen. So just to recap, we went from pre-procollagen to procollagen to a tropocollagen, right? And I like to think of, again, cleavage of the tips forms your trope. Cleavage of the tips forms your trope, your tropocollagen. And eventually the tropocollagen will be cross-linked together as reinforcement via lysooxidase. And this enzyme requires copper. And so this reinforces it. You got your really, really thick bundles of collagen. Now we're going to focus on type 1, 2, 3, and 4 in this lecture. Type 1 can be seen in bones, tendon, teeth, and skin. It has tensile strength. Type 2 is commonly seen in cartilage, hyaline, and elastic types, mainly function as structure, shape, and support. Type 3 type collagen is seen in reticular fibers, and we usually see this in granulation tissue and wound healing, as well as for support. I've given you some mnemonics on the side here. Bone is stiff and strong for 1 and tensile strength, cartilage to remind you of hyaline and elastic cartilage, and retricular or reticular for reticular type of fibers. Type 4 collagen can be seen in the basement membrane, and I like to think of 4 as on the floor for basement, and it has mainly structural, attachment, or filtration properties. Now remember, we talked about hemidesmosomes in the epithelial tissue segment, and they attach onto the basement membrane. In the glomerulus, the basement membrane has a filtration function, where again, many of the substances from the circulation will be filtered through into becoming urine. With type 1 collagen, and I mentioned this before in the connective tissue lecture, but I just want to emphasize that dense regular connective tissue is comprised of collagen type 1 fibers arranged in regular orientation. Remember, bone is stiff and strong, and we've mentioned the locations and its function. You can also see type 1 collagen in dense irregular connective tissue, right? It has more of an irregular orientation. We see this in dermis intestinal submucosa. Type 2 collagen, hyaline or elastic cartilage, right? These are produced by chondrocytes. Again, besides collagen type 2, hyaline cartilage also has extracellular matrix, which is comprised of proteoglycans and glycoproteins. Remember the mnemonic cartilage, main role is for structure, support, and cushioning. Where do we see this, right? Hyaline cartilage can be seen in joints, intervertebral disc, knee joint, right? Nose, larynx, trachea. Type 2 collagen, I mentioned this, that can also be seen with loose areolar connective tissue. And so again, it provides that kind of structural support of the loose connective tissue. And you commonly see this as a support tissue around blood vessels, nerves, and muscles. Type 3 collagen, I've also mentioned reticular connective tissue already, but don't forget retricular, right, is the mnemonic. So collagen type 3 fibers, and you can see this very fine, loose network here. This is your reticular fibers, very fine meshwork. And you can see this in the formation of the stroma of organs, bone marrow, lymph. With collagen type 3, just want to share with you an example here of granulation tissue, which is basically comprised of your connective tissue, fibroblasts, and blood vessels. It looks very busy here. Okay, you can see here some blood vessels. Now, I don't expect you to identify this on an exam, but here are some blood vessels and the connective tissue around it. Just imagine that all of this is going to be your fibroblasts producing all of that collagen type 3. And we'll talk more about wound healing and repair when we get into mechanism of disease. The main function is for template structure. Now, type 4 collagen, 4 is on the floor, basement membrane, collagen type 4. So this is produced by fibroblasts. You have your type 4 collagen here that's bound to laminin, right? And you can see here the basal lamina is this gray line right here, BL. And here you have your hemidesmosomes attached to the basal lamina, and then you have your reticular lamina, which is also attached to your basal lamina there. So on that note, I will leave you with the table of recap of your location, function, and histology of collagens type 1, 2, 3, and 4. Contact me if you have any questions, and I will see you at the next lecture. Thank you. Bye!